Thank you so much. Again, very warm welcome to everyone here today. My name is Aditi Das. I'm from RDA Consulting, and we are working very closely with LCBHS for today's meeting, which is the community planning meeting for financial year 2023 to 26 3-year plan. Scott, would you like to also say a few words?
Yes, my name is Scott Abbott. I'm the program manager for Mental Health Services Act. And some of you know me, and I just want to greet you all and appreciate, really strongly appreciate you being here. This is a really important matter that we deal with every year. And this time it's even bigger, just because what this is actually redeveloping a new 3-year plan, as our title card says right there. It's not just an annual update. This is a brand new 3-year plan. And this first meeting that we're doing is really to kind of set the process starting of building that plan, and getting stakeholder input, community feedback is vital to do that. I mean, the plan is basically based on the feedback that we receive from the community. And so having your input, you being here today to be able to contribute to that is really important. And I just really want to thank you for being here again, taking time out. I know you're all busy, and I appreciate your dedication and your concern to be here. And fortunately, what we have Aditi and Jamie, and hear from RDA, who we've contracted to assist us with this process for the county. And so I will turn it back over to Aditi and talk to you later.
Great. Thank you so much, Scott. And again, very warm welcome to everyone joining us. So I'm going to just move us along. And I think, Scott, thank you so much for laying the foundation for what today's conversation is going to be all about. So while we're waiting, I would love for folks to sort of just, we could do a round of introductions, especially, for those who are attending in person. If you could take a moment to fill out the sign-in sheet, that would be wonderful. And if you're online, we'd love to hear from you. So please definitely use the Zoom chat function to introduce yourselves. You could drop your name, your preferred pronoun, as well as the program if you're affiliated with one. So feel free to use the Zoom chat feature as we learn more about who's in the room. All right, great. So let's start off by just walking over today's agenda and some of the key objectives of our meeting. So to begin with, our agenda is going to start off with providing an overview of the MHSA process. It's sort of called the training and education piece, where we will give you a background of what the Mental Health Services Act is all about, as well as give you an overview of what this 3-year plan is going to entail. And as Scott mentioned, the community planning process is very much at the heart of this process. And then we are then going to talk about the status of all of the current LCBHS MHSA programs, where we will actually be hearing from the programs themselves. And then we will then get into breakout group discussions, where we will very much be focused on the needs assessment piece of this 3-year planning process. And this is where we'd love to invite your thoughts, your feedbacks, and we're going to have a facilitated discussion. So towards that end, there are 2 key objectives of today's meeting. The first one is, as I mentioned, is just to sort of present an update of the MHSA programs to help contextualize the sort of overarching needs assessment piece. That's very vital to the development of the 3-year plan. And it's also really inviting and providing an opportunity for stakeholders to discuss the community program needs and sort of looking for areas for improvements as we move into the next 3 years. Just a couple of meeting tips, for, again, those folks who are attending in person, we have an assigned coordinator at each of your sites to sort of help manage the Zoom meeting and facilitate attendee participation. Again, big shout out for all the coordinators who are helping us through this process. If you're joining us virtually, if possible, do try and see if you could find a quiet, distraction-free location. It's always, and of course, feel free to join us by phone if in case your Zoom video chat function isn't working. We also want to invite folks to drop in any kind of substantive comments, questions, or feedback that you might have in the Zoom chat. We will be monitoring the Zoom chat pretty closely. And again, if you're attending in person and if you have a question, I would kindly request folks who are attending in person to raise your hands, and then the on-site coordinator can kind of come up to the Zoom screen and let us know that there's a question from someone who's attending in person. So just a couple of quick tips that I wanted to relay to everyone. And again, ways of how to contribute to the discussion. Just want to again reiterate that we're very grateful for all of you being present here today and want to invite your participation. So there are different ways of how you can contribute to today's discussion. If those of you are joining us virtually, there is a raise hand icon within Zoom. Hopefully folks are relatively familiar with Zoom. And so kind of, if you sort of hover towards the bottom of the screen, you should be able to see that feature. Definitely raise your hand and we will address some of the comments that you might have. For those joining us over the phone, do press the *9 button, which will again prompt us that we have someone who would like to raise a comment. Please feel free to use the Zoom chat feature. There's the chat icon again at the bottom of the screen to type in your comment. And then lastly, we want to invite your comments. Please feel free to email Scott. Scott's email's right here. And I think some of you already have his email. So those are just different ways of how everyone can contribute to today's discussion. Great. So if it's okay with everyone, I'm going to actually just launch us right into the first section of our meeting today, which is about the Mental Health Services Act. This is the training and education piece of our discussion today. So just, this is an overview for folks who might not be familiar with what MHSA is, although this also could be quite redundant for folks who are well versed in it. So MHSA basically came out of Prop 63, which was passed back in November 2004. It's the 1% tax on an income over 1 million. And the idea is to really expand and transform mental health services. I see a hand raised. Yeah, go ahead. You're good to go.
Yes, my name is Les Miller. I'm with the Scotts Valley Band of Homo Indians in Lakeport. And I'm an elder here at the Pathfinders, the peer group here on Forbes Street. And I just think that everybody should introduce themselves so we know who we're talking to. But I'd like to introduce Connie Reitman. She's the chair of the Pathfinders group for the Circle of Native Minds. And her brother will be weighing in, Chris Partita, as more of an expert in the suicide prevention and all these services. So again, I think it's how we do it in Native culture is we introduce ourselves before we start going on with the program. Thank you.
Sure thing. Thank you so much. I really appreciate you bringing that up. We're happy to do a quick round of introductions, and I apologize. It's not like we don't want to do the round of introductions. It's just that we have a lot to get through, but I'm happy to hear from other folks if they'd like to unmute themselves and introduce yourselves to everyone. If we could spend the next couple of minutes doing that, that would be great. And Scott, would you like to call folks on, or do we just have folks?
Well, if I understand correctly, I think he would like to hear from the presenters to introduce themselves.
Oh, okay. I thought it was everyone present. Sure thing. So again, my name is Aditi Das, and I am from RDA Consulting. We are working closely with the LCBHS group that's being chaired by Scott. to help facilitate this entire community planning process. And we are helping develop the 3-year plan for Lake County. So it's very nice to meet you all. I can maybe also call upon my colleagues, Paulina and Jamie, who would like to quickly introduce themselves.
Hi, oh, sorry, Jamie.
Okay.
Hi, everyone. My name is Paulina Hatfield, and I'm also with RDA Consulting as an associate. And I'm helping both Aditi and Jamie with this community meeting, as well as the 3-year plan. And I'm really happy to be here and excited to hear from everyone and be a part of the conversation. Pass over to Jamie.
Hey everyone, my name is Dorsey, and I'm working in collaboration with RDA Consulting, and I've been working with Lake County for the last few years. And like Paulina and Aditi and Scott said, we're all really excited to be here, and the 3-year planning process is a big deal. So we really appreciate everybody's participation today.
Scott, would you like to reintroduce yourself to
Sure,
everyone? And maybe,
in case you missed me yabbing on at the beginning right here, my name is Scott Abbott. I am the program manager for the MHSA program in housing. I've been here for a few years, and this is our annual plan. And once again, we appreciate you all being here. As you can see, this meeting is both online and Zoom, as well as meeting spots in our peer support centers. So a true hybrid meeting that we're doing, and we plan to continue this format ongoing, as I think it allows the most flexibility for being able to meet for people, especially for people that it's much more convenient for them to meet like this, and but we also be able to meet in person as well. Now, Aditi, if you could pick back up where you were, because I know we are short on time.
okay, sounds good, Scott. Thank you so much. And again, I just put in a plug for those who are joining us. And, we apologize. We would have definitely done a sort of round of introductions and heard from everyone. But in the interest of time, if folks could like to chime in the Zoom chat, that would be great. Thank you so much. All right, great. So I was talking about the MHSA background slide. So just for folks to get familiar with this approach, there are 5 key buckets that you see right here on the screen, which cover what MHSA really stands for. The focus of MHSA is very much on wellness, recovery, and resilience, and to ensure that the services are culturally competent. Clients and family are very much at the heart of MHSA services. The service experience is meant to be very holistic and integrated, and it's really done very much in collaboration with the community. And this process that we're bringing to all of you today is hoping to sort of get through some of that. And then this is just, again, an overview of all of the key buckets that are a part of the MHSA funding process. So as you can see right here, a large proportion of the MHSA funding is really focused on community services and supports, which is the kind of outreach and direct services that are provided to folks who touch the mental health system. Then we have the PEI piece, which is really focused on prevention and early intervention, sort of prior to the onset of any kind of mental diagnoses. We have the INN, which is focused on innovation. So it's sort of testing out new innovative approaches, which are focused on improving outcomes. We have the WET, which is workforce education and training, which is really focused on improving the public mental health workforce. And then we have CFTN, which stands for Capital, Facilities, and Technology Needs, which are the sort of larger infrastructure support that are needed. I'm going to just put this slide up for about a minute so that folks can get familiar with sort of the range of programs that fall within these buckets that I just mentioned. You have the CSS group, which is the Community Services and Support, the PEI group, which is the Prevention and Early Intervention, INN, CFTN, and WET. Just a quick note, the outreach and engagement programs, as well as the peer support centers, are receiving funding from both the CSS as well as PEI buckets. So just a quick note about that. And the other quick plug is we will be actually hearing from a lot of the programs that you see listed here in the program report out section. So hopefully everyone will get more familiar with the programs as we learn from them. Okay, great. Again, this is just a quick plug on for folks who'd like to know more details about the MHSA program. We're going to drop the link in the chat, and it's right here up on the screen where you can learn more from LCBHS's MHSA website. Great. So I'm going to move into section 2 of our meeting today, which is really talking about the 3-year plan and what this community planning process entails. So just folks know the intent and the purpose of this 3-year plan is to help identify persistent mental health service gaps and develop strategies to address them over the next 3 fiscal years based on the community needs assessment and stakeholder input. This really includes the program status and service accomplishments that have happened in the past year, proposed program changes for the next 3 years, as well as program changes that are beginning this financial year. I see your hand raised. Just give me a second. I'll just go through the slide and then I'll get to you. And then as a part of that, we have the community planning process, which is really focused on meaningful stakeholder engagement, because we're definitely turning to all of you, that is folks who are a part of the mental health system within Lake County, to provide subject matter expertise to the development of these plans, and they will be focused on utilizing the MHSA funds at the local level. All right, I see folks have their hand raised. Yes, please go ahead. Circle of Native Minds.
Hi, Ishel Sparks with the Big Valley Band of Comos here in Lake County. I'm a victim advocate, domestic violence, sexual assault for the last 25 years. I first want to say that I'm really sad that we have to rush through this. I don't feel like you have time to absorb when you I'm not sure if something is this important, how it can be. I mean, I'm feeling like we're getting cramped already. And you don't have time to digest or ask questions, which is why we end up where we are with a lack of services and the kinds we need, because you guys are going to tell us quick, fast, and in a hurry. You don't even know who you're talking to, and because they haven't been introduced. And then to find out I'm sitting here trying to keep up, and we don't have any handouts to make notes on or anything. So I'm just a bit bewildered, if you would say. Because I would think anytime I've ever been to an important meeting, we usually don't get crammed and we usually get handouts so we can follow along. So I'm not sure how to proceed here.
Carrie,
can I just say something really quick? So
please go ahead.
This is basically the first meeting of many. This is an overview of what successes and challenges have been. The more in-depth meeting will be when we meet for our focus groups, like I discussed at our last meeting. That is where we are gonna, take all the time that we need and discuss, challenges, hopes, plans for the future of the centers, for the future of all of the programs that we have. There will be several focus groups after this meeting. So hopefully that will help. The intent of this meeting is to just do an overview of what we have and what our plans are, and then the focus groups will be more in depth.
Right. Yeah. This is, like I said, the first meeting of many.
That should be, the first meeting is really important to be able to comprehend what we're working with. So I mean, it's the foundation of it. So that's why, I feel like handouts would have been really helpful for us, because if this is foundational, then we need it to be strong.
We have all these on our website, this PowerPoint. And I would be more than willing to answer any questions that you have, maybe one-on-one, if you need some more background about MHSA, I can do that.
That more background about MHSA. I thought that's why we were here, and it's not going to help me to have them later. Right now, it's when it's helpful. So I get that, but I'm just saying, if you're truly reaching out to people and you want to hear them, then you need to make time to hear them, and we need to have the appropriate materials.
We can print those up right now at the circle.
Pardon?
I said I can ask staff to print those up right now and hand them out there at the circle.
Thank you for that, Carrie and Scott. I also want to say that if you have any questions after you've had a chance to review the material, of course, this is not a one and done. You can reach out to Carrie, Scott, or myself with any feedback or comments you have about that. I also want to address Christina's comment. The community health improvement plan work has identified for at least the past few years, behavioral health and mental health and substance use issues as a top health priority. And so here we are meeting to discuss resources and allocation of those resources in service of meeting those needs. And so that's kind of the intersectionality with regard to that work.
I just wanted to ask a clarifying question. Are you saying that 2 hours is not enough to discuss and fully disseminate, I guess, the information of the programs and then have a full discussion? If
You tell me, because we're being rushed.
okay, yeah. So I wanted to ask clarifying questions because I agree with that. I feel that it is a lot of information. So to actually have a good understanding of everything, it's really rough to do that in 2 hours. And then I can imagine focus groups being a pretty lengthy conversation. So I think that's something worthy of noting for the next time. So I just want to add my 2 cents that maybe that's something that we should consider for the next time.
Well, you've got to realize that we're trying to mix what you're doing with what we're doing. And you guys are professionals, even at Zoom. You know, I'm used to smoke signals. I'm an Indian. But what we're trying to do is communicate with each other so we can both benefit. Okay?
It's just do things differently, I guess.
It's a Caucasian one.
Thank you all. We definitely acknowledge and understand that, you know, the 2 hour time frame is always really tricky to work with, but I do want to follow up and reiterate that we will be having in-depth focus group discussions with each of the groups, and there will be multiple opportunities for folks to participate in this process. And you know, the reason we chose 2 hours is, I think, you know, historically we've learned that 2 hour meetings is sufficient for a hybrid meeting situation. But I think maybe what we will do ahead of our next couple of meetings is make the slide deck handouts available. And you know, we will ensure that all of the relevant materials will reach you ahead of time. We apologize if that has caused any inconvenience, but we definitely really want to hear from you, and there will be several opportunities for everyone to participate in this process. I just want to reiterate that. So thank you for raising that. I really appreciate it.
And I think also this might be, you know, one of your first times coming to one of these MHSA meetings. And Aditi's about to describe the process of the stakeholder community planning process. This is a multi-month planning process. It's not a 2 hour meeting that's, you know, where we make a plan. It's going to cover multiple months leading up to June, when we have we publish the plan that we've all come up with together, and get even more feedback on it before it's finalized. So like I said, this is just the very kickoff meeting of the process, and Aditi's going to describe that right now.
Great. Thank you so much, Scott. Okay. So before I sort of talk about the different phases, I did want to orient everyone as to what our PEI, that's the Prevention and Early Intervention Evaluation reporting, has been. So basically in FY 18-19, the MHSA Overseeing Committee, they kind of updated the PEI reporting requirements to include a more sort of in-depth evaluation of PEI programs. And so as a part of that, we have the PEI annual report, which kind of looked at the sort of last year and the status of PEI programs. And then we also put together the PEI 3-year evaluation report, which basically looked at program status, some details about consumer served and program accomplishments for the previous 3 fiscal years, as well as specific program implementation and outcome information. For this year's 3-year plan, we will be including this current year, that's the FY 23-24 PEI annual report. Just know that that's basically what's going to be a part of the 3-year planning process. LCBHS has been working very closely with all programs to strengthen data collection and outcome reporting. And really the idea with the PEI program specifically is to strengthen PEI specific reporting. So this is something that's different from what happened the last round. So just wanted to orient everyone to that. And we're happy to answer more questions around this if they come up. Again, just want to reiterate the list of stakeholders who are participating in this process here today. We obviously have a lot of you who are present. And this is really the entire program planning process is very much being developed in collaboration with local stakeholders. So this is basically anybody who touches the mental health system, right from consumers down to providers. So this is the list of stakeholders that we have. And some key roles and responsibilities that I'd like to identify to, again, big shout out to all of the stakeholders, many of you who are present here today. We definitely want to learn from your lived experiences and your perspectives about how we can have some emerging strategies to meet community needs. We have BHS, the Behavioral Health Services Department, Scott, Carrie, Patty, who are helping in the development of this 3-year plan and are tasked with implementing it. We have folks from the Mental Health Advisory Board who are providing advice on the 3-year planning process and also will conduct the public hearing. We have the Board of Supervisors who will be reviewing and approving the MHSA 3-year plan. And then there's us, where we're helping facilitate this process. And as I mentioned, you're just going to learn that we are, there are several meetings that are upcoming, including the focus group conversations that we're going to be hosting very soon. Here is just to give everyone an overview of the planning activities. As Scott just mentioned, this is going to happen over several months. So this is definitely not a one and done meeting. We had our kickoff back in December. We are now currently, as you can see, in the needs assessment phase of this process. For those of you who might be familiar, we are going to be dropping a link in the chat. We did launch a county-wide stakeholder survey. We really hope that folks have been able to answer that survey. If not, there are opportunities for you to respond to the survey now. The survey is going to actually be open until the end of February. We will, right after this meeting, be conducting focus groups with both consumers as well as providers, because it's important to hear from all of our stakeholders. And in addition, we will be collecting in-depth program data. And so all of that is basically going to get into the second, to the third and the fourth phase, where you can see that we have a program planning process, which is really synthesizing a lot of the stakeholder inputs. And then we're going to have and host an additional community meeting. This is going to be in the 3rd week of March. And then finally, the last phase is going to be the development of the 3-year plan, where we will publicly post the plan. We will host a public hearing process, and that will basically lead to finalizing the 3-year plan and the final presentation to the Board of Supervisors. Scott, did you want to chime in here? Or you're good?
Yeah, I just want to mention real quick, within the focus groups, we've been designing those to really try and get, a broad spectrum of interested stakeholders, trying to, have more in-depth discussions and getting that feedback. And so, as Aditi mentioned, it will be with providers of services, it will be with consumers of services, it will be with community members who are interested and who may not be, our providers, but have strong interests in what we do. And so it's really trying to get really a solid community feedback of ideas and where we should be going.
Great. Thank you so much, Scott. Okay, this section is, we as a part of the MHSA process do know that, there are certain processes that we need to follow. We do have to sort of launch a really quick stakeholder poll. And, again, we want to apologize that this was a lot of information that was thrown at you, but we want to just kind of launch this poll, which is really asking folks the question around whether you feel that you have a reasonably good understanding of the Mental Health Services Act, as well as Lake County's 3-year plan and the community planning process for the next 3 fiscal years. So if it's okay with everyone, I would really like to invite your participation, and I'm going to launch the poll right now. Give me a quick second. All right. I want to see, hopefully folks have that. Thank you. Thank you so much for your participation. Great. Any others? Great. And again, quick plug that, there are links that we're dropping in the chat where you can learn more details. The slide deck of this discussion today will be shared and uploaded along with the recording. So you can definitely learn more about this entire process, and feel free to email us as well as Scott if you have any additional questions. Great. Before I end the poll, so it looks like we have sort of a large majority who agree and are sort of neutral about their level of understanding. And again, we completely understand where you're all coming from. There are definitely opportunities to learn more about this, the MHSA Act, as well as this entire community planning process. Okay, I just don't want to, there we go. I think we have. Great, almost everyone's participated. Thank you so much. I will end this poll in the interest of time, and just quick share of results. Thank you so much. Okay, I am now going to move us along into the next section of our meeting. This is the program report out section. I'm just going to give everyone a brief overview of what this section is going to be all about, and then I'm going to actually hand it over to Scott. So just so that folks are clear, what we have up here on the screen are some of the questions that we actually pose to all of the MHSA programs who are part of the LCBHS system of care. They actually received these questions several weeks in advance and have had time to prepare. And so we are inviting programs to report out on these 4 key questions right here, which is, what are the biggest successes your program has accomplished? Do you have any data that you'd like to share that demonstrates your success? What are the biggest challenges your program has encountered? What's new? What are you working on right now? And what modifications or changes have you been working on? Right here on the left-hand side of the screen, you could see that we have a list of all of the programs who we will be hearing from. And just keep in mind that, we have a slide deck where you're going to get a lot of background data and information about each of the programs, especially things like the numbers served, some of the overview of the program, as well as just the demographic breakdown. And we will be hearing from programs. Each program will have about 2 to 3 minutes to speak about their program. And again, I apologize, this is a crunched time. And, we want to make sure that we hear from everyone. And so that's why we've oriented everyone, and we hope that you could stick to that time frame. Scott, I'm going to hand it over to you. I did see that somebody had their hand raised. Was it from the Circle of Native Minds?
Guess not.
Okay. Oh, maybe they,
Mm.
okay. Go ahead, Scott. Mhm.
Okay. You know, as we described, this is our first meeting, you know, discussing the planning process. And I feel it's important, you know, as we're planning forward, that we understand where we're at, you know, what we currently what we're currently doing, what programs currently exist, what current, you know, what's happening with our current programs before we move forward with plans. And I guess there is a hand from the Circle of Native Minds. They're on mute.
Please go ahead. I think you're on mute. Yeah, thank you.
No, we're just, it's confusing to us because we don't recall having that opportunity here at the Circle of Native Minds. And so this is all new to us in terms of, you know, what reporting can we give you? We haven't had that opportunity. So this is kind of an ongoing challenge that we are discovering as we continue to participate in the Circle of Native Minds program.
Literally, I mean, we lost our director also, so we're trying to pick up the pieces here.
Right.
Anything you can do to educate us would be very much appreciated.
You bet. In fact, I'd like to, you know, maybe spend some more time going over this with you. Maybe at the next Pathways meeting, we can do that. Okay. Going back to where we're at. Not sure which program we have first. I think it's Crisis Continuum.
Yes.
Is Summer here?
I am here.
Oh, great, Summer. Could you describe that real quickly? Well, I mean, before you jump into that, I just want to let people know. So we'll have the way this will work. I've asked each for the sake of time, each program lead to talk, you know, 2 or 3 minutes about their program. So as you can see, it's going to be it's going to be just an overview. While they're talking, we're going to have a slide in the background that you can look at and kind of see, you know, what they've done as far as, you know, numbers served and who they served in 2021 or 21-22. Sorry. So, Summer, I'll let you go.
So hello, everybody. My name is Summer Trongo, and I'm the supervising behavioral health clinician for the crisis team. As you can see, the team is made up currently of 3 crisis workers, and I step in because we are short one. Give me 1 second, my computer's going to die.
Oops. Well, maybe we can go to the next one.
There we go. I'm back. So we currently have 3 crisis workers with myself and 1 case manager. Over the past year, we were able to reach out to 149 consumers through the crisis outreach, which means they received linkages services after either being released from a hold or released from a hospital. The biggest challenge that we had, obviously, is the staffing. We would like to have more staff to reach more people, but unfortunately, that's been an issue. We are currently working on expanding to a mobile crisis project, which would provide resources to reach more people within the community. And currently, we do not have any modifications or changes.
Great. Thank you, Summer.
You're welcome.
Next slide. We have the forensic program, and I've asked Crystal to talk about that.
Okay, so I'm Crystal Rodriguez, the current supervisor for our Forensic Mental Health Partnership, and that will be changing over to Carolina Pimenta as we are currently transitioning there. Says number served 18. I think we're actually a little higher than that. But I don't have that exact number on me. Our biggest success right now is that we have been able to build some really strong relationships with our justice system, with our judges, our lawyers, probation, which has been extremely helpful in our collaboration together. Our biggest challenge has been staffing, which is improving. We've been able to get some more staff hired or brought on to assist providing services. So up and coming, we'll be starting the kickoffs for discussion on care court. We continue to have discussions with the court clerks, upcoming meetings with our judges to improve how the program runs and communication and collaboration. So it's been a really positive movement forward. And I see us being able to really improve our numbers and our outcomes in the future. And another success is we do have a lot of people that are completing and graduating diversion, which is really exciting. So I have 4 of those coming up in the next 2 months. So that is where we're at right now with our forensic populations.
Great, thank you. Full service partnerships. So our FSP, Full Service Partnership, is a program which is the largest program of the Mental Health Services Act. If you remember the earlier slides that talked about community support and services, which was 76% of all MHSA funding. Of that 76% of MHSA funding, half of that is required, at least half of it is required for FSP service. So as a result, this is our greatest service, which the state has and the law has said, this is also your most important service. And so it addresses the needs of the most vulnerable in the county, in our community, who have severe mental illness and need as many wraparound type of services as possible. I've asked both Crystal again to talk about the adults that are being treated in this, and Zabdi to talk about youth that are also in this program. Crystal?
So for our adults, we have approximately between 35 to 40 consumers currently. This past year, we have been able to access low-income housing at a higher rate than we have in the past. So, which has reduced our transitional housing costs, as well as housing subsidies that we pay out through MHSA funds, and improved the self-sufficiency and independence of our consumers, which has been really exciting for our team because it's been the most we've gotten housed in 1 year in some time. Again, our biggest challenges is our low-income housing and the length of the wait lists that we face, being our rural small county. We are implementing more groups to provide services, such as right now we have a coping skills group, and we are getting ready to restart another DBT group. And we'll also be beginning to implement a co-occurring group service as well here upcoming, with the hiring of staff that also is SUD certified. One of the projects we're working on too for our FSP is our FSP innovation project to make our criteria very clear the guidelines, graduation statuses, and what that looks like for each individual. So we're really excited and hoping that'll bring a lot of clarity to not only within our agency, but our outside community partners as well about criteria and guidelines and requirements.
Okay, thank you. And Zabdi, for everything about youth?
Yes, thank you, Crystal. You kind of took some of my thunder. The same sort of applies for youth. So the difference is that for full service partnership for adults, we're looking at the SMI, severely mentally ill population. Whereas with youth, there are different factors that would qualify them for services. So we're really trying to prevent from these youth to become an FSP adult consumer. So that whatever it takes model may look a little different. So the biggest successes, they're a little different. So when we're talking about youth, they come with family. So one of our greatest successes, for example, were that we were able to help a youth under 10 and their family get temporary housing, and that in itself helped reduce a large amount of their symptoms and hospitalization rates, and were able to then access permanent housing, and now they're approaching graduation. These cases take a while to reach to that level. Usually it takes months and months to get to that point. So whenever we have a graduation, it's a big deal for us. The biggest challenge has been, I think we'll hear this over and over again, is staffing. And more specifically, I want to say clinicians. So the availability of therapy, for example, is very scarce. For this population, typically case management, individual rehab services are primary, and then therapy comes as needed. But I could see therapy being, especially therapy with the entire family, would be a great support for this program. But staffing has been a challenge, and I think that's just the case across the board. Things that and then also permanent housing that is affordable for families. That's been a big barrier for folks to be able to successfully graduate earlier than what is happening now. So we'll be able to get them temporary housing, but then, it's helping them get linked to permanent housing, to something that they can afford on their own. That's been the struggle. So, and we all know that that's kind of the case in Lake County right now. What's new and what we're working on, Crystal already mentioned, we're working with third sector. We're looking at process improvement, creating trainings. First, we're working on internal. We have done a little bit of we're building a boat and then just testing it out and then seeing if it works. With regards to our work with third sector. So we're still trying to iron out all the processes that we're developing. And then once we finalize, then we can do a final training and then share it with the public. So that's still in the works.
And we'll talk about that. We talk about innovation too.
Oh, there you go. Okay. So that'll be covered more later. And then, yeah, the team is in transition. Additionally, the addition of a new mental health specialist for this group, and she will be focusing on TAY, which is something that, again, we've been doing as best as we could, but having a mental health specialist specifically focus on TAY, transition age youth, and focusing on that specific important time of youth's lives and helping them manage symptoms and behaviors while also learning how to become an adult. That will be incredibly that would be amazing for our kids. So yeah, that's all I have on youth FSP.
Thank you. Older adult access. Again, I've asked Crystal if you could just talk briefly about this, and I'm also going to ask Chloe from Canocti Senior Support to address this.
Our older adult population is the smallest. We do have an older adults group going currently, which they do seem to be enjoying. We're, reducing the isolation, communication, building relationships with peers. Our biggest challenge has been staffing, as well as the pandemic, being able to at points reach out or go to senior centers, a level of isolation and fear of not wanting to go out into the community or go to doctors. So we didn't have as much, I guess not contact, but there was some struggles there, of providing the services, based on their fears of COVID and the pandemic. So we're steadily trying to build back up in the services we're providing, getting groups going. We have staff that are really out there with our older adults, working hard.
Thank you. And Chloe, are you here?
Yes, I am
Thank you.
here. Yes, I'm muted. Well, thank you for asking us to participate. I have heard a lot of what Crystal said fits with those seniors that we are working with. We are a peer counseling program, which means that we have trained peer counselors, and our responsibility is to ongoing train and recruit more. So to start with the successes, some of our successes are that we've had clients certainly appreciate the people, our counselors reaching out to them, and they feel it has increased their self-esteem and their ability to move to maybe a different level of living without as much assistance. In the community, we helped a client move out from a stressful living situation into an independent. We've helped a client take some action with new landlords, with cleaning up a place that was let go when the building was sold. We've acknowledged, our counselors have acknowledged our triggers of the senior We Are counseling program. So when they feel a trigger, we help them by knowing that they can turn to the counselor. And of course, accepting outside help, which is always a challenge. And I think Crystal kind of referred to that. So the other aspect of success is just the retention of our small group of counselors. When I started, I didn't have really any background or understanding of how we could work with behavioral health, and I'm still learning. In fact, the process that we took, that I was asked to take part in, has helped me, and now we can maybe begin to reach out and get more information and more data. But it's been a challenge because of just starting sort of in a vacuum. And that's been a characteristic of our program. And we hope that we'll work more closely with the peer centers and with the programs that I'm hearing about right now around the community, because we do serve the entire county, and that's difficult. Seniors don't go out. We have to reach out to them at home. Meals on Wheels and our discharge planning from medical services has been very helpful in our recruitment. Let's see what was next on what's new. What's new is that I applied for a mini grant, thinking that we could reach out to seniors. There's a huge disparity, of course, with seniors getting service, but it's very large with those who have vision loss that has just kind of come upon them and they don't know. what to do about their vision loss, or that there's even help. So we applied for a grant, and we've had an overwhelming response to the mini grant to MHSA, and the grant amount was cut by more than half. So presently I'm working with a CEO of an agency in Santa Rosa to try to figure out how we can reach a lot of the people that have responded to us. So that, I guess that's going to come on under innovation, because we're going to have to figure that out. Sorry, I'm taking a long time. As far as modifications, and the other thing is that we're working on our training program, and it's been hard to recruit people for a lot of reasons to be senior counselors. The ones we have excellent retention, but to reach out to more, and we've served, say, 40 people and seniors in the last year. We're now at a training, some tentative dates set up, and we're reaching out. We're getting some response to an 8-week training program in March and April. So that's coming up. I just want to say, as far as the modifications are, that we want to have the opportunity to take part in this planning process and expand our outreach in the community. We'd like to have Lake County Behavioral Health include our programs in your media efforts, as you include the peer counseling, the peer centers around the county. Please include us, put us up on your, sites that you have, because a lot of people don't realize what we do, and we really want to highlight. Seniors are so often forgotten. I do want to just say that the PER process that I filled out has been helpful, because now I see the ways that we can measure outcomes. And I didn't know about how to do that when I came on 8 months ago. So anyone that wants to work with seniors, please contact us so that we can coordinate our services with yours. Thank you.
Thank you. I see a hand up real quick. In the circle.
Yes, I was wondering, I see an entry here on the right side of the screen. Caucasian is 100%, American Indian and Alaskan Native. They have no entry. I was wanting you to explain that.
Well, that actually doesn't reflect. We have, we have a client who's a Native. We have clients who are Latino. I'm not sure how it came down to that 100% exactly, but we do need to do more outreach. And I'm sorry I didn't mention that, but that's a huge challenge. And can we work together? Can we?
Do you have the phone number for the Circle of Native Minds?
Yes.
Yeah, give us a call. We'll set something up so we can work together. I'd like to see some numbers on that board for American Indians.
Absolutely. Yes. Thank you.
Thank you.
You can do it.
Thank you. Okay, next slide.
All right. So my name is Abdi Naria again, a program manager for behavioral health or clinical services, and I'm presenting on trauma-focused co-occurring disorder treatment. Program description, trauma-focused treatment acknowledges that unresolved traumatic experiences, whether as a child, adult, or both, predispose a person towards substance use as means of coping, self-medicating, or dissociating. Co-occurring is a broad category that recognizes the fundamental intersection of mental health and substance use disorders. These issues often seem to coincide and reinforce one another. According to medical necessity and availability, eligible clients will receive trauma-informed co-occurring psychotherapy. This program adopts a whole person approach to treatment. So as you can see, the total number served is one consumer. Unfortunately, the pandemic hit this program really hard. We had groups in place before the pandemic, and we had regular consumers attend these groups. And then once we went virtual, things became a little difficult to continue. So as far as the successes, however, I do want to mention that screening has continued through our intake process. We have several screening tools that help us make early detection and linkage to services. And additionally, it informs the clinician when we need to have co-occurring treatment. So as far as the program specifically, where they're under this specific program, it's not happening in that way, but services do come in a co-occurring manner naturally. The changes are that Crystal had mentioned earlier, we have staff who are certified to provide substance use disorder services on our mental health department. So as under several programs, actually, the CalWork, CWS programs under Catalina Pimenta, and Justice Involved under Catalina Pimenta, and then the FSP adult population under Crystal, we will be able to bring this program back in full force. So we have that to look forward to. Other challenges include, again, having staff who are competent to provide these services have been difficult. But again, we have just recently hired additional staff who have certification in both areas. So I'm very optimistic about this program coming back and doing what it's intending to do. And that's it for this program. Thank you.
Thank you, Zabdi. Okay, we're going to go through and talk about our peer support centers, and I've asked Carrie if she could do that.
Sorry, I was trying to figure some stuff out with the shelters. So Carrie Manning, I am the supervising behavioral health clinical specialist for the Mental Health Services Act services and programs within Lake County Behavioral Health Services. I supervise our peer support centers, including Lavos, Circle of Native Minds, Family Support Center, and the Big Oak Peer Support Center. We also collaborate with the Harbor on Main. I also supervise our suicide prevention programs, and I assist and work with the Lake County Continuum of Care. I could talk about all of our successes and challenges over the past 3 years all day, because there have been a lot. But I only have like 3 to 5 minutes. So I'm going to start my timer. So challenges with the centers over the past few years have been staffing and COVID, obviously. But currently we are almost fully staffed. We are currently recruiting for our Native American and Latino cultural specialist positions. We've been collaborating with the Pathfinders group at the Circle of Native Minds and the Spanish speaking community and recruiting for both of those positions, because it's critical that we find candidates that are an active part of those communities, respected in those communities, so that we can provide effective services and meet the specific needs of their communities. And in general, the needs of Lake County residents have increased. And so we're constantly working, as you can see by some of our numbers, we are constantly working on developing new services and programs to meet those needs. So some of our huge successes have been, we have been able to hire 3 new outreach and prevention specialists. So we now have 5 total outreach and prevention specialists that are providing services out in the community, as well as at some of our centers. This is allowing us to reach more of the community by meeting them where they are, learning what their needs are, and working on assisting each of them with meeting, those needs. Each of our specialists are connected to the populations that they're working with. So for example, older adults, youth, Native American community, the Spanish-speaking community. And even though they have specific populations that we're working with, they work as a team, and providing self-awareness classes, suicide prevention education, mental health first aid. But Kendra will be talking about all of those shortly. We launched the outreach van in July of last year, 2022. So far, we've had over 1,600 contacts with community members. We've provided cooling and warming supplies, provide lunches every day that we go out, hygiene supplies, most importantly, linkages to services. Real quick, one of our biggest successes was recently housing an older adult veteran. It took collaboration with Nation's Finest, the VA, us, Catholic Charities, but we were able to help this gentleman that was very ill get housed. So, they assist in trying to connect people to housing, medical care, and other emergency needs. Overall, with all of our centers, collaboration with our community partners has been the biggest success. We partner with Lake County Helping Hand to provide food distribution at Lavos and the Big Oak Center. At the Big Oak Center, it's 2 times monthly. We collaborate with Adventist Health to provide showers weekly at the Big Oak Peer Support Center. Catholic Charities helps people during that event apply for Medi-Cal and other assistance. There are other services available, including, lunch, free phones, linkage to community services, outreach, nurse, and clothing. Also there, we are now open 7 days a week, providing a warm, cool place with a meal and a helping hand. And all of the centers are now access points for our coordinated entry system, allowing our unhoused neighbors or people in jeopardy of being unhoused apply for housing vouchers. All of the center staff have also applied to become certified peer support specialists, and the department is working on creating a career path for our valued peer support staff. So the Family Support Center has moved into the building with Lavos, and we're planning to provide bilingual support to families, caregivers, parents, in supporting them in navigating systems and improving life skills. We've hired a new parent partner as well. Lynn Farmer joined us recently. She's going to be housed at Lavos and Clear Lake, and we're looking forward to the new groups and services that will assist our families in developing new skills and linking them to services that they will need. Lavos has got many support services available to the community, and we're going to start doing more groups, including life skills, self-awareness, question, persuade, refer, and they also moved to a new location over the past few years on Lakeshore. The Circle of Native Minds moved into a new location in Lakeport, which put us closer to downtown and the bus stops. This is allowing us to be more accessible to the community, and love the new location because it's going to provide us an opportunity to have a garden and other activities there. We have been collaborating with the Pathfinders group a lot. That collaboration has increased, and we're developing a plan for future activities at the center and for outreach services to the Native American community. We're also planning on having food distribution there, hopefully starting next month, as well as culturally specific groups and activities, both at the center and on tribal lands, and art groups, life skills, and other support groups. So I think I made it in about 6 minutes. So thank you.
And I see a hand up at Circle Native Minds again.
Do you guys want to unmute or?
We did, no, we're just, it's interesting that this information is being presented, and it's not being shared during the course of the year or outreach and engagement activities. So the other thing is, we're looking at 882 consumers, but we don't, it shows unknown or not reported at 47.
Caucasian or
Hispanic. So so we're still not seeing the information being shared or the outreach and engagement that we're hoping would happen for the Circle of Native Minds in our tribal communities. So it looks like
more natives are being served than are.
yeah. So
Carrie, this is Les Miller.
Hi, Les.
To go back to the staff segment about hiring a director for Circle of Native Minds, I would like the powers to be to consider the cultural expertise, not just the education part, because this is a specialized position that can really help in with the suicide prevention, especially for the young people. So it's very important that we get somebody who knows the territory, not just an educated person who's going to do the data. So that's a good point.
Totally agree with that, Les. That's why, in our last hiring, we had the Pathways representatives present to help with that.
Good. We'll see more of that because that is so important. Because a lot of these people won't talk about these issues to anybody. You have to be culturally have access culturally. So that's my point.
Thank you.
Right. I know you and I discussed having cultural peer support
Yes.
specialist, correct?
Yes.
Yeah. Okay. Just wanted to make sure that got put in here.
I think the key is that there isn't any follow-up, from any kind of technical assistance provided, so that there can be, more an expanded input about how that can happen, how it might be implemented.
I'd like to see the written criteria for hiring in such a job position that the county uses.
We can get that to
That
you.
is on the website.
Yeah, it's on online. We can get that to you.
Okay.
And Kathy, you had your hand up.
Yes, thank you. Let me lower my hand. So I got a couple things, but I'm going to start actually with what Les was referring to. One of my questions was that what is it looking like going out to the tribes and on the reservations and the outreach, literally working boots on the ground with the tribal members and suicide prevention training? And if not, are we giving them the tools to reach out to Project Calwell with the California Department of Education so they can get the suicide prevention literally to the tribes? You mentioned about the parent partner. I just had some well, not concerns, but I'm wondering like what the role was, what's that going to look like? Is parent partner going to be working with families that
to
are,
answer your,
I'm just trying to run this through, Carrie, and then maybe if you could take each one that way, because I know you're on a time frame.
right.
Zach and Abby,
So You can give me a call directly too, and we can talk about some of this, but we did recently hire a Native American outreach and prevention specialist, and she is working with several of our tribes locally to provide the QPR, the question, persuade, and refer training, the gatekeeper training, as well as working with our youth in the schools. She's planning a youth big time or Gona. I can't remember exactly which one. But she is working a lot out in our Native American community. And so that's very exciting. She's also being trained in mental health first aid so that she can provide that training as well. And she's stationed at the Circle of Native Minds. She has a lot more plans. If you want to, maybe reach out to her and ask her, that would be great.
So just because we're on a time constraint, I did want to share that Social Security now has just come out and they created office for focus on tribal outreach. So Social Security is going to be going to the tribes. They're going to be going to them to have elders sign up for Social Security. So we're not having to have elders go out in the community to sign up for Social Security, or if they don't have access to the internet. Secondly, I just wanted to bring attention something that bothered me last week. Actually, I was coming home from work about 6 o'clock. It was kind of getting dark in Lower Lake. The homeless population has risen everywhere in Lake County and everywhere actually. But there was an elder, probably 70s, in a wheelchair, talking to a sheriff. He was having some problems. In my field, I offered some support. He said that he had called a crisis and was not getting, he wasn't getting any support from the crisis line. So he did not know about Hope Center. I shared with him about Adventist Health across the street. Perhaps they can give her a warm handoff. And then she said that Hope Center wouldn't take her because she had a dog. He was worried about her getting hit run over in a car because she was in a wheelchair going down Morgan Valley.
Can you give me a call or
well, I can. Just 1 second, Carrie. Yeah. I just think it's important for the community to know. The sheriff had not had any information about the crisis team navigator program that you knew, and he didn't have any tools to help this woman. That's what I want to say. We're on a community forum here, and I'm just saying as a community member, the sheriff did not have any tools to help this senior citizen. Okay. So I just wanted to let you guys know that the law enforcement is not, somehow they're not getting the information, the tools to help our community members. And that's just sad. So that's it.
I agree.
Okay. We got to get back going to our program. Else we're going to, I really want to be able to go through these programs so everyone in the community can kind of see where we're at. So I encourage you, if you have further follow-up questions or discussion, please contact Carrie or myself, and we or any of the people that are presenting, and they can answer your questions more fully. But we're really running short of time, and we still have a lot of programs to go. I'd like to go back to the slide of the harbor on the main and have Kim talk about that real quick.
Good morning, everyone. Kimberly Guerra, Program Manager, Redwood Community Services, Lake County. I do want to take this opportunity to introduce our new supervisor, Kara Ingram. She is on the call today. Kara is taking over the harbor, the NEST program, and our home SLE. I will try to run through this pretty quickly. So the overarching goal of the harbor is to increase safety, well-being, self-sufficiency, to ensure a successful transition to independent adulthood for transition-aged youth 15 to 24. I really want to call, I'll notice some successes first, and then I'll talk about some challenges, and that is in relation to the data that is also being shared on the screen right now. So some of our most notable successes are that the harbor provided approximately 4,500 services to 218 individuals and had at least 1,359 visits from children, youth, and adults in Lake County. Of these 4,500 services, approximately 1,500 were food related, 240 were accessing the clothing closet, 440 plus utilized our technology center. 366 individuals attended targeted focus groups. 553 people came into the harbor for drop-in services and socializing purposes. 362 accessed services and or received referrals or information about mental health services. 148 received hygiene supplies or hygiene kits. 159 participated in life skills classes, and 115 received services related to housing and homelessness. Based on our youth surveys, 96% of participants reported that they are happy with the friendships and other social connections. 100% of participants reported that when they are feeling emotionally overwhelmed, they turn to others for support and help. And 96% of participants reported that I am satisfied with the way I handle stress, handling it in healthy ways rather than engaging in self-destructive habits to cope. So those are just some of the notable successes and data we'd like to share. We've significantly expanded in the past fiscal year, both, let me say that again. We have expanded in the last fiscal year, both physically and programmatically. Some of our most notable successes occurred sort of in the last half of our reporting period. But particularly this is within our Harbor Youth Board. They created an annual plan and they've been really doing some amazing work in the community and both within the center. And another success is kind of aligns with some of those challenges is that we had been very short-staffed for a very long time. In fact, we had one peer support counselor running the harbor for like the past 2 years. So kudos to Raven, who's also on the call at the harbor. None of this could have been done without her. So I do want to talk about some challenges, and this really relates to the demographics. So I'm seeing even on here that it's saying in places 57% of our race and ethnicity was unknown or not reported. I'm concerned about the accuracy of the data that's being shown on the screen. I know I did have to resubmit a demographics report, so I'm wondering if this is the appropriate one that I had shared. And I also want to bring attention to the clear discrepancies in the way that we are collecting and disseminating data for the harbor, as we are the only contracted provider for Lake County behavioral health for these peer support centers. You see a drastic difference here in the number of consumers that is reporting that we are serving compared to what the other centers are. And I am really concerned and confused about how we are collecting and what we're reporting. Because I just feel like it's not showing the true work of what we're doing, and especially in comparison to the other peer support centers when you look at this total number served. So something we've been talking about for a really long time. Anyways, I think it's really essential that the peer support centers are all utilizing the same type of data collection so that we can ensure the accuracy of reporting, especially when it comes to our community and our stakeholders. And then, as I mentioned, we were struggling for a very long time with staffing, but we were happy to report that with the addition of other funding opportunities and funding streams that we have been able to hire more staff. And so that has made a tremendous difference, especially when it comes to workload and staffing capacity. And some of the changes that we are really, really excited about upcoming does have to do with our youth advisory board, some of the projects that we're planning in the next year, and then also one of our mini grants that we are so appreciative to have been a recipient of, where this year we will be facilitating a queer prom for youth in Lake County. So very exciting, lots of great stuff, but in interest of time, I will zip it now. Thank you.
Thanks, Kim. Okay, let's move forward. Early intervention services, one of our prevention program, sorry. And Zabdi, I think you're going to talk about that for me.
I was talking to myself. My name is Abdi Naria, Program Manager for Clinical Services. Actively, I'm supervising early intervention services as well. Early intervention services, the objective is to provide early detection and intervention of youth and young adults who are developing early signs of psychosis and mood disorders. The goal is to decrease the duration of untreated psychosis and mood disorders before they become debilitating. The intended outcome is to reduce mental health symptoms 5150-fold, reduce homelessness, psychiatric hospitalizations, incarceration, and school failure or dropout. Actively, the team consists of 4, including myself. We do have a new supervisor who was recently hired, and she should be starting within actually next week. And this individual has gone through several trainings to support this program. So that's something that we're really excited about. The successes include the early detection component, where we're really looking to see if there's anything that would make someone potentially high risk and really provide intensive services similar to FSP, where it's really a wraparound approach without having to be FSP. I think that is a big, it's huge because we've learned that stressors actually increase psychosis symptoms. So when we're able to come in and provide basic needs and support individuals and understand psychosis, we notice that the stress decreases and symptoms improve. So we've had several successes within the team where we've seen that exact situation happen several times, come in, support, and then symptoms improve. Similar to all programs, staffing is a significant challenge. Therapy specifically, with the onboarding of a new supervisor, clinical supervisor, she will be of great support to an extent, because again, she'll be a supervisor. So I think that's just that it's consistent across the board, access to therapy and clinicians. And yeah, there's more coming with EIS and more to come on that. That's all I have.
Thank you.
Scott, I think we do have a question from Circle of Native Minds.
Okay. Question.
Not so much a question as a statement. I've just recently participated in the culture club for the Lakeport Elementary, and we're going to be doing outreach. I'm asking Haley to join me next time. And it's, you talk about prevention. That's where you hit it right there. So very good group. More are coming on. From my experience going to the elementary school, there were only 2 of us, me and Steve Elliott, that finished 8th grade. So these young kids, that's where you hit them with prevention. So I'm reaching out to that, and the coordinator there is really a good expertise on that. So I just want to add that.
And also, Haley has been doing a great job at the big time that she does. That's separate and on her own time. It has nothing to do with mental health services. So I know that was brought up, but that's not outreach done by mental health services here in Lake County. That's on her own time.
I am extremely grateful that we have Haley.
Me too.
Super fortunate that we have her. Okay, but we need to move forward. Thank you for your comments, and we'll look forward to talking to you more. We're not going to talk about the family stabilization well-being or the NEST program. Again, Kim, I asked her to talk about this. This is one of her babies.
Thank you. I thought you said we weren't going to talk about it. And I was like, no.
Oh, of course we're talking about it.
Thanks, Scott. So the NEST stands for Nurturing Education and Skills Training Program. It is a transitional housing program for youth 18 to 25 who are pregnant and or parenting. So it includes their children as well. During this time, families work with a 3-person team. That is the home specialist, program supervisor, child development specialist. It is a youth-driven process to reduce risk factors and increase self-sufficiency. Since program inception, which I believe was 2012, we have served a total of 158 individuals. 62 of those were moms, 12 were dads, and we served 84 children. a lot of our successes really have to do with the individual work that our clients do. There are no successes of this program without the participants who and the consumers who access the services. But I did want to say that at least in this last fiscal year, 7 participants became employed while in the program. 7 NEST participants who exited the program left to safe and stable housing. 1 NEST participant celebrated 1 year of recovery while in the program. We've had multiple participants obtain their driver's licenses, become gainfully employed, access higher education. Just a lot of great, wonderful work. We've welcomed in new babies, which is always one of the most exciting parts of the work too. We love the little ones. Lots of great successes. We do actually have a youth at the Nest who has an incredible success story. Just for the sake of time, I know that we can't have her share that today, but I'm really excited about being able to share that in the future with her permission. But some of the challenges we face, and you'll hear it a lot, is finding affordable housing. So from the moment that a nester walks into the program, we are working on developing, doing budgets, having them fill out housing applications, saving for application fees, connecting them to services. And as you know, housing in Lake County is incredibly scarce, and many of our youth are not typically considered eligible to rent, especially when you compare to the greater population who has longer history of established credit, employment, rental history, things like that. So that seems to be some of our biggest challenges, particularly because this is a 15-month program. You would think that's enough time, but when you're considering that the low-income housing opportunities have really long wait lists, 15 months goes by really quick. So some of just what's new or some changes, we're constantly welcoming in new families. And we're going to be beginning another round of nurturing parenting classes in collaboration with Lake County Office of Ed, and utilizing the harbor as a training site for that. And then all of our nesters are being connected to the Pathways program to increase some of those case management and supportive services, and assist in helping identify other housing and or additional needs they may have. And I think that's about it. Thanks.
Thanks, Kim. Okay, next, moving along. The Friendly Visitor Program. I've asked Rebecca.
Hi, I'm Rebecca Reese from the Friendly Visitor Program. We're half of Canocti Senior Support. You already heard from Chloe, who does the Senior Peer Counseling Program. The difference between the two programs is that we do not offer counseling, we offer companionship and life enrichment. The program the services are provided by volunteers. I recruit the volunteers and match them with the clients who I also recruit. Our biggest success is that since I took over the program a year and a half ago, we went from serving 4 clients to now last year we served 19, and currently we've served 14. The reason, and we went from 3 volunteers to about 11 volunteers. And that's related to our biggest problem, which of course is COVID, which affects senior citizens most strongly. So since our volunteers are senior citizens and our clients are senior citizens, there's a lot of natural resistance to becoming involved in any social situation. So I would say that what's new is we are trying to start a group at a senior center, the Lucerne Senior Center, which is unfortunately the senior centers also had to really reduce their services. So we're not really able to use that social venue to bring people together, but we're working on one at the Lucerne Senior Center. Modifications, we're doing more, we're changing the way of evaluating the program according to your suggestions. And right now I'm doing just outreach, asking people, did the program by phone, did the program improve your connectedness? Did the program reduce your loneliness? In the past, we were sending out evaluations in letter form and we didn't get any response that was noticeable. Sorry, I just had a phone coming on here. So I want to thank the people from Circle of Native Minds for reaching out. I would love to have some of you be, someone in the Native community be volunteering with us. I'd love to have clients in the Native community, and I'd love to hear cultural information that would benefit our volunteers. So thank you.
Thank you. Next. We did senior peer counseling, okay. How about next? Otherwise. We have
Scott, Scott, we did have a hand raised. I just.
Oh, okay.
Go ahead. From the circle.
Michelle Sparks again, to answer the lady that just spoke. We have been here 3 years and we're willing to collaborate. We didn't know again about that service. And then just to echo what Kimberly Guerrera said, I'm just looking at the statistics and the total of consumers served on these different ones. I had said it to the elders here that just looking at all of this, I'm really concerned about the accuracy, how it's collected and the accuracy of it. I have no faith in looking through this and even doing math. There's over 100% on some of these, and then others of them, like what I'm looking at right now, 78% unknown reported. I mean, how does that happen? So I just wanted to echo what she said and thank her for saying
it. Well, these are based on self-report when clients are at these locations, and sometimes they choose not to put down what their race or ethnicity is.
Well, except that I know in my report, we had very, very little unreported data. So that's where I'm wondering, like for the harbor, where that large number came from.
It came from you. It was based on your reporting.
I don't have 57% of unreported data, demographic data in the stuff that I've done. So that's where I'm wondering if it was the wrong demographic survey or something, because that's not accurate.
Okay, well, we can work with you on that. Okay, is Sabrina here?
Hi there. My name is Sabrina Andrus. I am the interim executive director of Motherwise. Today is my 3rd day, so forgive some of my ignorance on some of these. With the data reporting, I just want to also add, so you'll see 78% unknown and not reported for our race and ethnicity. And I too also think that's probably not correct. It's also probably what we gave you. So that's our job to go figure that out, which I'll do. And so I'll have a much more richer look at that later on. So our success is really tied to our bread and butter, which is Motherwise's concierge program. These are staff members who reach out and maintain really deep, intentional relationships with mothers in the community. We, as you can see, our total number served, and that's probably higher, is about 2,000. That's with 1.5 FTE staff. So that's 3 people, none of whom are working a full-time load. So it is absolutely incredible the work that they're able to do with such a small, teeny staff. And we really exist, so Motherwise exists, for those of you who don't know, to make motherhood a little bit less scary and a little less alone for people in Lake County. And many of you know, right, that mothers really are the beating hearts of their families and of their communities. And I don't say this to disparage dads and fatherhood, but we know that when there are healthy mamas, there are healthy families and healthy communities. So when we're talking about prevention, we're going to the source. So while one of our biggest successes is the sheer reach, and what we do through our concierge program is provide either tangible goods that people are looking for, right? A call to look for baby monitors, bottles, things like that, to something that I think is talked about even less, another reason we exist, and that is connection. And it's connection with other mothers, whether that's online or it's connection with other mothers or our staff in person. Because the biggest, scariest thing in the world with stigma is silence. The more we don't talk about it, the more it exists and really digs roots. This number, the 2,000, it does represent a wide range in age and race and ethnicity. And I wrote a note here that, you can see some of those numbers for yourself, but we're currently revamping our entire data gathering process so that we can provide an even richer picture. And I'm really, really looking forward to hearing what some of the other centers are doing, the peer centers, so that we can start to be collecting some of the similar data. So we're comparing a bit more in the apples to apples range. That's my just sort of data nerd piece of me. Our biggest challenges are really similar to a lot of what we're hearing now, and that is, the pandemic fundamentally altered how we do a lot of our work. For a couple of years, the economy is poised to make it even more difficult for families, and we're trying to do more with less funding, like a lot of you are. And then, as I mentioned before, too, the shame and stigma around postpartum and mental health issues with moms, whether new mamas or moms of more than one kiddo. And then the other piece I'll add to this, which is another reason I'm really excited to be here, and that is a couple of misconceptions I think that folks have about Motherwise. So either not knowing that we exist, so we're not getting the referrals that we would like from healthcare providers, mental health care providers, teachers, that kind of thing. It's part of why I'm now on board. And then the other is that this misconception that we have criteria for helping or providing services. The criteria is, are you a mother? That's it. That's the beginning and end of the screening process. It means that we don't ask for insurance. It means that we don't care about your age, income, socioeconomic status. So many of you know that perinatal mood and anxiety disorders don't discriminate, and neither do we. So if you're a mom, we will help you. And what that means is we will help you regardless of your socioeconomic status. A lot of people think this is a low-income issue only, and postpartum depression and isolation related to motherhood hits everyone, regardless of what your background looks like. We're really excited about a couple new things in the works. First, we've hired just a wonderful bilingual concierge who's really hit the ground running. She's able to meet with Spanish-speaking mothers, but also translate everything that we do into Spanish so that our services are more readily available. Our in-person services has resumed. That's our weekly gatherings. But what we are, if we're sort of looking to the future, which of course, requires some money, we're really excited about bringing back what used to be called our auntie network, and that is in-home visits, right? Another challenge that we're seeing is moms carrying on more than one job. They are doing all of this work with one car for the family. Getting to a physical location, particularly when we only have one, can make it really challenging for them to get through the door to then be welcomed into this giant community that's ready for them. So on that front, we want to resume the auntie network, which is the in-person, have a host of volunteers ready to go, and then also open up some satellite offices in areas where folks aren't able to get to us as well, Clear Lake, Lower Lake, South County. I have a lot more, but I'll probably stop there.
Thank you. And Sabrina, I just wanted to welcome you to you said you just started 3 days ago. So welcome to our community of MHSA.
Thank you very much. I will say one other thing that I'm excited about too is I'm going to be doing a little bit of a listening tour with moms and healthcare professionals, and a lot of you guys have been just scribbling down names. I really want to hear how Motherwise shows up in the community, what we're doing well, what we can do better. This work isn't done in silos, and the mamas in our community need us to do good, intentional, purpose-driven work, and that means being in partnership with others too. Thanks.
Great. Thank you. Okay, next. Outreach and engagement. Carrie, you talked a little bit about this. I just want to kind of add one more thing before we move on, just on the sake of time. As Carrie mentioned, we do have an outreach van now. We do have specific outreach workers. Those were all resulted from these type of meetings. We heard that it was really important to have more outreach to the community, and so the result of that is new staff and an outreach van to be able to accomplish those type of things. We're going to be building that more and more to do that, to get out more, participate in everything from the point in time counts to just making sure that we maybe have a sack lunch for someone that might need it. Carrie described helping people find housing. So it's really our growing program. We also mentioned Haley and the Circle of Native Minds. We also have Tom, who's doing older adult outreach, and he'll be working with the two programs that were mentioned here, with Canuck Senior Support to be able to work together, and with our older adult program, and with Haley and those outreach efforts, because they're, as we mentioned, they're a team. And I see Carrie is this busting to say something, so I'm gonna let her do that.
I just wanted to mention that, the outreach van and our outreach services are near and dear to my heart. I started out in outreach work back in 1998, and the van right now, I got a call from Lakeport PD while during my presentation, actually, and on how are we going to transport people out to the shelter. The warming shelter is having a soft opening today, and so while listening to everybody's presentations and stuff, I got a hold of Davey, and so Davey and Melanie are on their way to take lunches out to people, as well as go pick people up and start getting them out to the shelters. So it's not, I appreciate all the data, but it's not always about the data. It's about the qualitative information that we get. It's about all of those lives that we're touching during the pick counts, during our outreach. And we are working with the governing bodies on tribal lands to be able to go out onto land so that we can provide outreach. We're trying to be respectful, we're trying to be equitable, and it's just it takes time. And, we want to make sure that we're doing an effective job. And, I just want to say thank you to everybody that's out there working in this field. So.
Okay, let's go to the next slide if you could. Okay, Kendra will be talking about this, correct, Carrie? Okay, Kendra. I hope I didn't steal your thunder before, of all the great efforts that you're doing. Kendra is another one of our outreach and prevention workers.
Good morning, and that's all right, Scott. Yeah, I did have a little something that I wanted to talk about as far as our outreach and engagement, which is I refer to the community events that we hold out there in the community or go to and table at, and just the fact that we get to offer information, resources, and really make a connection with, I believe this numbers were saying that it was over 800 local community members that we get to talk with. And really it's about those building that connection and relationship with those that are out there. So I was excited to see our slide up there about those particular activities out there in our community. Also right here, when we talk about our mental health first aid, it's a training program that provides education and wellness, recovery and resiliency, really with the belief that individuals experiencing mental health challenges can get better and use their strengths to stay well. It serves both adults and youth. We served about a total of 114 adults and youth combined during the 21-22 fiscal year. Some of our biggest challenges besides COVID is actually getting adult attendance to some of our trainings. And so we're hoping that with the new things like of hiring more outreach and prevention workers, and that will become certified in mental health first aid trainings. It's our hope that with more instructors, it will offer more opportunities to our community, our adult community members to join. I'm trying to think of some of the other things that we have. We also have other prevention education programs that include question, persuade, and refer, know the signs, self-awareness classes. And these programs provide services to our junior high students, our high schoolers, and adults as well. And if we want to, I have other information if we want to talk about our mini grant program.
We probably don't have a whole lot of time.
Okay. We already covered some of the their mini grants. I just want to say that with the mini grants, the Lake County community, it's an opportunity for our community to develop prevention-oriented activities aimed at building protective factors and reducing risk factors with respect to mental health. In the 21-22 fiscal year, there were 11 mini grants that were awarded, and services were provided by Any Positive Change, the Coltrane Transformation Station, Hospice Services, Redwood Community Services, Robinson Rancheria Business Council, Sunrise Special Services, and Scotts Valley Band of Pomo Indians. Those are some of our community organizations that were able to receive mini grants for that year. And if you have any questions and would like some more information on any of the programs that I just briefly spoke about, you can contact me through email and I will put that in the chat box.
Great. Thank you, Kendra.
You're welcome.
Scott, did you want me to go back to this suicide prevention? I skipped over to the prevention
Yes.
mini grants. Okay.
Part of our PEI funding goes into suicide prevention, also goes to state and regional and local projects, which include suicide prevention, including our suicide prevention hotline that we have. It's a regional hotline. We also do, as mentioned, working in, this is a lot of stuff that Kendra and Michael do with QPR training and know the signs and stigma reduction type of things that we do. We also contract with MHSA to assist in providing some regional type of things where they put together some programs that whether it be mostly it's informational type of programs that we pass on to the community and use that. Let's go to our next slide. Did that. Innovation, we just talk about that real quick. Zabdi mentioned that, was starting to talk about that. Innovation projects, what they are is that's 5% of our MHSA funds, which are used for innovation. It's an innovation project which needs to be approved by the state. It's some kind of project that will do something different than hasn't been done before. Something that new and just to try something and see if we can get something new to work. In the past, most recent past, we've done a project to create the Pathways Hub, which is newly developed, and it's a project where we can do closed loop referrals back and forth and be able to do more care coordination. It's a really nice ongoing project that we're still involved with. It's also been funded by the Whole Person Care Grant. But our current innovation project is our multi-county full service partnership program. And what that is, that's specifically designed. This is a multi-county. It's run by an outfit called Third Sector, who are kind of coordinating this in doing trying to improve the eligibility criteria so it's more standard, trying to improve how people can graduate from the program so it's more standard, using data to better inform how programs should be developed. And so this is kind of exciting. You heard me mention before that FSP is our biggest program. And so we really thought it was important, if that's our biggest program, we need to do everything we can to make sure it's being done as most efficiently as possible. And so that's the purpose of that particular, and it's also nice to hear what other counties are doing and what ideas that other people have. So it's a good thing. Next slide. Workforce education and training. Also one of our key components of MHSA, and I've asked Danny to talk a little about, he's our WET coordinator. You there, Danny?
Hello.
There you are.
How's everybody doing? I am Daniel McAtee. I am the Workforce Education and Training Coordinator for Lake County Behavioral Health Services. I don't have a lot because it's still a very new program. So far, our biggest successes of the program in about the last 9 months since I came full time into the position was the re-implementation of the WET Regional Scholarship Stipend and Loan Repayment Programs for our current clinical staff. It's been pretty successful. We've had one stipend awarded to one of our clinicians who is going to be graduating with their master's degree. The stipend award was $6,000. And then we had 6 recipients of our WET regional loan repayment programs for their student loans for the award total of $55,813.91. So it's been pretty exciting to see that. We've also got our training committee functioning once again, which is nice because we've been able to create an onboarding curriculum for new staff coming on board. We are currently right now creating one for supervisors or management that are promoting or coming on board as well. After that, we'll be going into more position-driven training curriculums for other positions in the department as well. Back to the scholarships and stipends and loan repayment programs, we've also been able to get the approval from Cal MHSA to also include not only our clinical staff, but also our administrative staff who are also still going to school or getting their degrees and also have graduated. And some of them were included in those totals as well. And we've also been able to enroll our substance abuse disorder program in the Health Resources and Services Administration, HRSA, the STAR student loan repayment program through them, which is pretty exciting because any help our SUDS folks can get is great. The biggest challenges this year, there aren't a lot of training programs for WET coordinators. It's very learn as you go. So we've just been building this as I learn, basically. The position description with MHSA has a myriad of different programs within the program. So it can be quite cumbersome at times. And then my biggest source of learning has been to reach out to other WET coordinators in other counties and finding counties that actually have WET coordinators, because it's not really a job description a lot of counties have in their classification lists. So deciphering which positions handle the workforce education and training part has been kind of an experience in its own. Right now, we are currently structuring a new scholarship program we call Grow Our Own. The scholarship program's function is to encourage local Lake County high school students to be interested in the behavioral health careers and to enhance staff professional development as well. We would fund a scholarship program that can help pay their tuition, books, or any other level of college expenses they may experience. The contract is currently underway, and we should actually hopefully have a draft this next week for that scholarship program. The new thing we've been working on for a while, and it's actually starting to really come together, is our new training center that we have planned for Bevins Court and the community room there. We've got the clearance from the fire marshal. He will be clearing that for us for up to 49 people in the room, which maybe we could probably hold these meetings there someday. So it'd be pretty exciting. And that is everything in a nutshell.
Okay, thank you, Danny.
You're
I
welcome.
appreciate that. What is an important program? Just want to echo that. What is an important program? And that we are living in a mental health provider shortage area. And you know, Danny talked about growing our own, which seems to be the best thing I think that you can do. You know, you can recruit from out of county, but it works much better to grow, you know, within our community. People have roots here and are more likely to stay here. And so that's one of the big purposes that Danny's working toward. Kind of moving right along, our next one is our CAP facilities and technological needs. And I've asked Elise if she could just briefly comment on that.
Absolutely. So CAP facilities and tech needs, we have two initiatives right now. One is the rollout of a new electronic health record. Our current electronic health record is very old and not that great. And so we're excited to go live with our new record on March 1st, and hopefully that will be a dramatic improvement for our clinicians, and it'll be easier, so it'll free up more time for them to actually provide direct services. And that project is being funded in part through these MHSA dollars. Our other large initiative is to renovate and expand our South Shore Clinic in Clear Lake. If any of you have visited that Clear Lake Clinic anytime, you're aware that it could use some help. And so we currently are working with a planning grant through the Behavioral Health Infrastructure Project to develop the new floor plans and all of that kind of stuff and go out to bid for a contractor, which we hope will put us in a good position to apply for a larger grant, and MHSA funds will contribute to that overall project.
Thank you. Thank you very much. Next slide. I think that concludes our programming. And it also concludes pretty much our meeting, unfortunately. As was put in the chat by Jamie and Aditi, we have really run out of time to be able to do the breakout discussions, which we were really looking forward to doing. So what we plan to do instead is to beef up some of our focus groups to be able to have people contribute more within that and have more discussion. But I really thought it was important, you know, before we, you know, head into that discussion is have people be aware of what already exists. And I could see, you know, from some of the comments in the chat that a lot of people didn't know some of the stuff existed. And so it's really important that you know what we have, what we do before we you know, take the next step forward. So as it says up here, we have our next steps in the DDI. I guess I'm probably talking over you, and I'll turn it back to you.
That's totally fine, Scott. No, thank you so much. Yes, so just very quickly, you know, some of my colleagues have been adding these details in the chat, so definitely feel free to look over them. But our next steps are very much going to be getting into some of these details and discussions, and we would like to invite folks as participation. You will be hearing from us very shortly. And again, these focus groups are going to be hearing from both consumers as well as the providers. And so all of that information, as you know, including the survey links that we dropped, we have launched a stakeholder survey, which we sent out a couple of weeks ago, and it's going to be open until the end of February. So please, again, participate. I encourage everyone to participate in the survey. All of that information is going to basically be presented at our second meeting, which is in March. This is the third week of March. Following that, we will be developing the 3-year plan very closely with LCBHS, which will be slated for April. We will be posting it for public comment in May, and then we will be hosting a public hearing in June. So this is so that everyone sort of is familiar with the upcoming timeline. Again, really quick plugs. This is the link to the community survey. We have paper versions of these at the centers, and we've been dropping the link in the chat, so look out for that. We are also inviting everyone's participation on just providing feedback about this meeting. We definitely know that there are some areas for improvement, and we hear you. We appreciate all of the inputs we've received from everyone today. So feel free, if you can, take out your time to complete this. That would be really helpful. And then finally, thank you so much. The recording as well as the slides will be up on this website very soon after. And if there are any additional questions, you have our details up here. Please feel free to email us, and we can continue this conversation offline. I just want to take this time again to thank everyone. We really appreciate all of your inputs. And Scott, any last words from you?
Yes, again, I appreciate you hanging. I see there's still 34 participants. I appreciate you hanging in there with us. Again, your time being here is so important. Be able to do this. The MHSA is based on stakeholder planning, and so having your participation, your knowledge of what's happening, and being able to offer feedback is super critical for us to move forward. And so thank you again for your time. And as I mentioned earlier, if you have some questions you'd like to follow up with me, I will be more than happy to talk with you or email you or however you'd like to communicate. And I hope to see you in the focus groups that we're doing coming up. Thank you.
Thank you, everyone. Take care. Have a great rest of your day. Thank you.
Thanks
Bye.
again. Take care.